order the Radnor Board of Health meeting for today, Monday, March 17th. Let's start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so first on the agenda is the review and approval of minutes from February 18th. If anyone hopefully someone had a chance to look at them. Anybody have any additions or corrections to the minutes from last month?
I just had a couple spelling, which I'll share.
Excellent. Anyone else? Okay, great. Anyone move to approve the minutes?
Move to approve.
A second.
Great, excellent. So next on the agenda is our organizational issues. So we have a new board member today, so I'm going to put him on the spot and make him introduce himself. But his name is Dr. Aaron Ocker, and name might seem familiar to us because he has a family connection here. So go ahead, Aaron, tell us a little bit about you, what brought you to the board.
Good evening, everyone. Thank you for having me. Glad to be here. So what brought me here is my wife, Lee Ocker, sitting to my right. A little about me. I'm an anesthesiologist out at Reading Hospital. Prior to that, I was at Jefferson University Hospital. It's where I trained, did residency in anesthesiology and a fellowship in regional anesthesia and acute pain medicine, as well as did a lot of work with quality improvement, which was what I guess the aspect I'm hoping to bring to the board here. My wife had noted a spot here, and since we always talk policy together, had encouraged me to put my name in the applicant pool, and that's what brings me here today.
Are you primarily in administrative, or no, that's just part of what you do, and you see patients, do pain management?
So primarily clinical, and there's a small residency out at Reading Hospital, so I'm primarily in education as well. I do help run the acute pain service, so largely what we're doing right now is we're expanding our peripheral nerve block service, which is a catheter service, so we can continue our perioperative pain management and really reduce opioid consumption postoperatively.
Excellent. Anyone else have any questions to put Aaron on the spot? Okay, great. It's wonderful to have you.
Welcome.
Thank you.
So just wanted to point out some health-related dates. This week is actually National LGBTQ Health Awareness Week, and there are online events sponsored by the National Coalition for LGBTQ Health that are available, including one event that was talking about a survey that they do once a year called the LGBTQ National Health Survey. And I believe that one's held on Thursday of this week, but there's also one or two other informational sessions. The theme of the week is Health Equity Now, and I would encourage anyone, if they are interested in that, to check out the website. I was always wondering where Alex got the information about all the months and everything, and you put it in Google, and I'm not exaggerating, it comes up with 10 things that it is the National Something Month. So I just picked one or two that I wanted to. It's also National Nutrition Month, so thinking about our nutritionists and dietitians. And it's Colorectal Cancer Awareness Month. So I know at Einstein Montgomery we have a big push during the month of March to contact patients who have not had colorectal cancer screening. I suspect other hospital systems in the area do the same, so people may be hearing more so from their primary care doctors regarding that. One other thing I wanted to mention is that, and call the public's attention, is that there is an event that's coming up which is called Wellness Week at the Willows, and it is April 6th through the 10th. It's starting out the week with a walk on April 6th, and concluding with a luncheon on April 10th. But mostly what it is a opportunity to do like free health and wellness classes. So it's different members of the community who come in and put on some classes. So some examples are the fitness center's doing a boot camp. There's a physical therapy that's discussing prevention of falls. Other topics, there's like teen yoga, slow flow yoga, information for student athletes, nutrition classes. There's probably a list of about 15 classes throughout the week. They are free. They ask that you do register online, so you can go to willowparkpreserve.org. And then the walk is actually on April 6th at 1:30. This is a charge because they're basically trying to benefit or raise some money to benefit the preserve. So it's $20 per person or $40 per family or a group of 5. So if you have you and 4 friends go, you can pay $40. There's going to be crafts for the kids. There's going to be health and wellness vendors present. It is rain or shine. And it is 2 miles through Willows and Skunk Hollow parks. So hopefully it'll be a nice day for that. But yeah, I hadn't heard too much about that, although I am starting to see signs around the community.
Dogs allowed?
On leash. So yeah, does anyone, go ahead. Hopefully. Does anyone else have any events or, I know that the school did have a drug awareness informational session last week that I had mentioned last time. I was not present, but I heard there was a good, a lot of people came out for it. Does anyone else have any comments about upcoming programs, health-related dates? Okay. So now we're going to move to student intern updates. So I don't think Bob's here, but Babby and the interns, you guys can let us know how things are going.
Yeah, Alice is here today, and things are going well. We just spoke a couple of days ago about your project. Do you want to just talk a little bit about how your project's going, Alice, and what you're thinking about?
Yeah, so I just about finished the research portion of my project, and currently I'm working on making a list of questions that I plan on asking about 35 students at Radnor High School. So I'm going to ask about 4 to 5 questions just kind of relating to what they feel like stress level wise, and then I'm going to kind of lead them through like a few breathing exercises, and the goal of that would just be to kind of like see how that has a direct impact. And then finally I'm going to be working on a poster, and I'm going to try to get it approved by Dr. Mack in the next month.
So my project is focused on examining the correlation between the nutritional value of school lunches and the academic well-being and performance of students at Radnor. And as part of my research, I was going around and looking at the food and snacks in the school vending machines, and I'm in contact with my guidance counselor right now to get approval for the survey I finished, and we are planning on meeting later this week. And I also hope to get in contact with the Radnor High School food service coordinator like sometime this month, and I'm excited to gather insight that could help us understand the impact of school lunches and their correlation to academic performance. And I did also begin making my presentation based on the information I gathered from the National School Lunch Program, a federally assisted meal program regulated by the U.S. Department of Agriculture.
Have you come across anything about that program being changed? As we know, there's lots of changes, federal changes. Is that something that has been mentioned? I don't know if you've come across that.
There are sodium regulations and stuff
Okay.
that they're putting in place that has to be mandated by schools do have to put into place by 2027.
Okay.
And I forget I can't think of the top of my head the other regulations, but there are regulations that they're requiring by a certain number of years.
Excellent. Anyone have any questions for our interns?
When are you going to be doing presentations? Will it be April or
I think the plan was May.
May?
Yeah, I mean,
Good.
June
I couldn't
would be
remember whether you
possible,
had-
but I think
yeah.
your like out of school by then, so you might be
So May.
vacationing somewhere nicely. So May is usually our goal. Okay, so next on our agenda is me once again asking Dave to give us a communicable disease update. I know it's one of my favorite parts of the meeting, and I appreciate him continuing to do it.
You're way too kind, and I'll ask for your forbearance because there's a lot to talk about, and we're still in the time of year when respiratory diseases are the most talked about and communicable diseases. So let's start with flu. We are in our 4th consecutive week of decreased flu activity, although activity remains high. And flu is still a risk for those at risk, especially for those who are not vaccinated. This is our first high-severity season of flu since 2017-18, and it is the highest hospitalization rate since 2010-2011, and there have been 134 pediatric deaths. Antivirals remain safe and effective for those who develop symptoms to limit duration and severity of disease. And we're probably out of the window where one could recommend this season's seasonal inoculation for protection. So one should be more aware of the ways in which one can protect oneself. Again, this being predominantly fomite, but also droplet driven. So hand washing and not touching your face are probably really, really good things to consider and to continue, and mask wearing for those who are at the highest risk. For influenza, probably an N95 is not necessary, but KN95 is probably adequate for protection for those who need protection. COVID activity is low and decreasing. There are a few areas of concentration. It's really hard to get good data. People have kind of, if you simply take the literature as a survey, there is very little focus on acute COVID, and the focus has now moved to long COVID, for which I am grateful, and for which I think over the remainder of my term on this board, it will be an increasing issue. At-risk populations are still at risk, and people should take appropriate precautions. Vaccination rates are very low. With flu, I should have probably grouped avian flu. I don't want to spend too much time. We spent a lot of time on avian flu. It is a bigger issue right now for eggs, poultry, milk, beef, and pork than it is for humans. There is still no documented human-to-human transmission. Thank you. My own personal opinion is that avian flu will not be the next pandemic. There's a pandemic coming, but it probably won't be avian flu, but it could well be. My logic being that you would now have to have 2 significant changes relatively simultaneously. That is the ability for transmission from human to human, and an increase of virulence, what do you call it? Boy, my head is just not working. Modification in the virus for this to become a major human epidemic flu. Hopefully we will still have the public health infrastructure to continue to monitor. That's not at all clear. RSV is low, and it's decreasing, so it's now a sporadic disease. It's mainly in pediatrics, although some high-risk adults are being hospitalized. Pertussis remains elevated, but that's kind of pertussis. It's really not necessarily a seasonal disease. This is one where vaccines are recommended for all. You should also be aware that if you have exposure to pertussis, post-exposure antimicrobial prophylaxis is affected, and you should get in touch with your healthcare provider and consider doing that. Mycoplasma peaked in late 2024 and has continued since then to decrease, and so it's sporadic disease. And that brings us down to measles. Every week it could be, every month it could be an I told you so. This year we are in March 17th. Over 300 cases. Last year total was 284. The year before it was under 150. The year before it was well under 100. This is a direct correlation with a decrease in inoculation rates where 95% is the theoretical required inoculation rate to prevent outbreaks, and we have fallen nationally below 93, but there are pockets below 80 and even more specific pockets below 20%. And the major outbreak ongoing in Texas is related to a community where the religious exception was taken in greater than 80% of kids, and now we have a lot going on. There have been 2 deaths. These are the first death was the first fatality in greater than 10 years, and the second is the first time we've had more than a single death in over 20 years. It's just what you would expect when you stop vaccinating for a disease that was essentially eliminated by vaccination. And as a consequence of what is going on, I think we have to keep an eye on smallpox, polio, mumps, and German measles, which were essentially nearly eradicated, and as a consequence of lack of public trust in vaccination, which is a consequence of significant amount of disinformation, we might expect to see those recurring. The other issue that could contribute to that is the fact that some of the other cuts in government public health, predominantly in non-U.S. countries, but are related to HIV, smallpox, polio prevention programs, and although they are in other countries, it is a global world. It just is. I think two things maybe. There's no evidence anywhere that is it castor oil or cod liver oil is going to prevent or treat. But vitamin A deserves a discussion. Vitamin A treatment for the hospitalized is clearly provable to be beneficial if patients get 2 doses at the levels recommended for age. On the other hand, there is absolutely zero evidence for the prevention of transmission of measles by vitamin A supplementation. Absence of evidence is not evidence of absence, but it's been looked at, and there has been nobody yet who has been able to produce any evidence for the on the internet recommendation for vitamin A to prevent measles. It should be noted that a significant proportion of the benefit in the outcomes for people hospitalized with measles who are given vitamin A may well reside in those individuals who actually have vitamin A deficiency. And although globally, from an epidemiology point of view, vitamin A deficiency predominantly resides in low income and low development countries, there are places in the United States where dietary habits might reflect that. So there may be vitamin A deficiency in sporadic areas within the United States. So remember, however, there is potential toxicity for vitamin A supplementation, and includes liver, skeletal, CNS, and skin toxicity. So you're going to hear a lot of vitamin A talk. You can't just brush it off. It's complicated. There is actually room for significantly more information, and hopefully we'll be able to generate that. I think that's all I have on communicable diseases, and next month we will probably be moving into focus on fewer respiratory diseases and more insect-borne diseases as we move into the warm weather months. Thanks.
I know there were 2 local-ish. I mean, most of the measles outbreak is in Texas and New Mexico, but there were 2 local cases unrelated to one another. I think one was at CHOP in King of Prussia, and the other one is just kind of failing me at the moment. But definitely something to be aware of in this area.
The one at CHOP King of Prussia was if you read the story, it was quite interesting. This was a person who, in the 2 days before they were hospitalized with the disease, had traveled by plane from China, by train from New York to, I think, D.C., by train again to the Philadelphia area. So it's probably a testimony to the fact that in this region there still are fairly reasonably high levels of measles inoculation, that we don't have an outbreak here. Thanks.
And I think to that point, in terms of what people can do, concerned citizens, it is worth for parents with young children a conversation with the pediatrician about potentially having, if you're close to 6 months out from a due vaccine or something like that, whether it's indicated at this point. I think right now the biggest concern would be possibly out-of-pocket cost if you're off a vaccine schedule, but again, depending on a child's exposure potential and things like that, it might be worth exploring. And then obviously titers for older population to see where they are.
I am not sure about the cod liver oil because I haven't really read a lot about that, but what I do know about that is it's very high in vitamin A. So I don't know if that's the relevance to that or not. But do you think that we saw in COVID, study after study showed the low vitamin D levels and people who were getting severe COVID, a direct relationship with that. So I do think that bolstering the immune system is something that the community should be aware of and doing through nutrition, since this is Nutrition Month, and getting supplemental sun or vitamin D, I think would be good for the immune system all the way through.
I think those are really reasonable comments, and I make a lot of sidelong criticisms of the current trends in our National Healthcare Administration, but in point of fact, we have an overnourished in terms of caloric count population, but I think that there's a lot of room to improve public health on the basis of nutrients other than calories, and the focus in the area of nutrition and its role in public health. And one of our student intern projects, I think, really does deserve a lot of attention. And what you said about cod liver oil containing vitamin A, and that feeds back in to, there are a lot of things where there are subtle issues, so that toxicities of mercury are probably most common in places where there is selenium deficiency.
Yes.
And there's a lot out there to be learned. So, yeah, thanks for jumping in on that.
Any other thoughts on our communicable disease update?
I have one question. If anybody's read anything more recent than I have, which was about a month ago, the committee that gets together to make recommendations for next year's influenza vaccine or the fall's influenza vaccine was told not to meet. And I don't know if there's an update since last month, but that's very concerning to me. I assume that means they'd stick with the same vaccine as this year, not having any new information. But I don't know. Maybe they've been allowed to get together. I know I heard Paul Offit talk about it about 3 weeks ago.
So that committee, which is a U.S. committee, is not going to meet on schedule. We don't know whether it will meet subsequently. But the global committee, I do not believe is affected by that. And there is actually a podcast. It's a CIDRAP, and Mike Osterholm, who you may remember from being around a lot during COVID epidemic, does it every 2 weeks. He does an infectious diseases public health update, and he did mention that, and I can't remember exactly what he said. He said, but bottom line was, we're not dead yet in terms of formulating a new vaccine, and it is not a U.S. only function. And his last one, which was he does every 2 weeks, and I think it was a March 6th, so he's coming up on a new one, and he does talk about that on his podcast. And if you're interested in public health, it's kind of a fun podcast. He goes over a lot of different things.
Yeah, I'm just doing a quick Google. I don't see anything specific that they have met since then. Right, so next on the agenda, we have a presentation from Kathy Wright. This is a initiative from the Delaware County Health Department and is being shared with us by the League of Women Voters of Delaware County.
Hi there. Yes, my name is Kathy Wright. I'm a nurse, and I also am a member of the Radnor League of Women Voters. I'm sort of the health liaison there. So anyway, just a few words before I start the 12 slide. So I'm here because the League of Women Voters of Delaware County asked our league to please disseminate this information and put out the word of this lead-free 123 that started February the 18th. And this PowerPoint presentation explains our Delaware County Health Department's initiative to increase awareness around lead poisoning, to encourage testing, and share prevention strategies. This campaign was funded by a $188,819 grant from the Health Resources and Services Administration of the United States Department of Health and Human Services. Lead poisoning is especially concerning for young children and pregnant women, as exposure can lead to serious health issues such as slowed brain development, lower IQ, and speech and hearing problems. Lead hazards still exist, especially in older homes built before 1978, which we have a number of them in Radnor Township, including my own, which is 1927. So this data came from a 2022 study in Delaware County that showed 307 children out of 9,000 tested were found to have elevated lead levels. Our county health department's goal for this campaign is to let everybody know, families and landlords and healthcare practitioners, to be able to understand that it's still a concern. And Radnor Township, as I said, does have a large proportion of our housing with a high likelihood of lead exposure based on the age of the houses. It also shows that when the testing was done, there were children with elevated lead levels in our community. So, no, there's no quiz. Read it at your leisure with coffee or tea or a soda in the morning. Not on plastic bottles, so we don't get mycoplasma. Drink this red. Anyway, the quick sheet, that second, gives a summary of what parents should know and what parents can do if they have questions or concerns. Several weeks ago, our Delaware County Council voted unanimously to accept the $1 million in funds from the HUD office, hopefully it'll still come, of lead hazard control and healthy homes office to enhance the lead safety across our communities. The initiative will be supported with a 10% match from the Community Development Block Grant. The grant earmarked for lead abatement in 35 homes in our county, which house children under the age of 6. So those were deemed to be our most vulnerable at that time when the study was done. So let me see. Okay, so these are friendly lead monsters is what this has, so that children can see it. And there's a huge, and the spring of 25 is when it's coming out, obviously. And, oh yes, okay, there's a little friendly lead monster. Yes, is lead lurking in your home? These are friendly lead monsters, seriousness of effects of lead or poisoning. And this is all over our Delaware County. And these are the lead awareness campaign collateral signs that are being given out and shown. Probably in some doctor's offices, I hope, pediatricians' offices. Is lead lurking in your home? And there's obviously some key messages. One small speck can see if there's lead in a child's blood system. And I like the different languages, of course. And then this is the statistics I told you when I spoke. And it shows the density in the different areas of Delaware County. Get tested, get inspected, and stay connected. And then, of course, there's a website, and billboards, and bus shelters. And then these little monsters that kids, and that's a sign on the highway. Let me put, oh, I hit it again, he said.
Used to love playing at this window, but one day my parents said I couldn't play there anymore. They said the paint chips were monsters and could make me sick. They took me to the doctor for a test. Then my mom took me for ice cream, and some people came over and looked all around the house and cleaned and repainted the window while I was away. My mom says they scared all the lead monsters away. I used to love playing at this window, but
So, yeah, so it started in February, 16 weeks, the billboards and the shelters, and then it's going to be continuing to go on, and hopefully will continue to be spoken about. The end. Do you have any questions?
Could you go back to the density map?
The one that I passed out?
No, the.
Oh, on here?
yeah,
Sure.
if you could-
I can go backwards. Alrighty, good. Mm.
So the white, were they tested and simply no toxicity found, or were they not tested?
Are those the municipalities that don't participate in some of our county?
I guess that's the question.
Yeah, well, Tinicum, I know, doesn't, so, right. And Marple, I thought, did in some of the things, but I don't know that. But that is a question for our folks at the county. And obviously, this is on the county website, too, on the, Delaware County Health Department website. So, but that is a very good question. Are there 7 of them? 1, 2, 3, 4, 6, 7, 8, Marcus Hook? I don't know, but that's, could have some correlation.
Thank you.
I did announce this at the 2 Board of Commissioners meetings, and I'll see what I can get up on the website as well, here on the
Sure.
township, just to link to
Sure,
the
just
Delco.
FYI for folks.
Yep.
Yeah, absolutely. Thank you.
I was going to ask a question, but it looks like it is on here that looks like encouraging families to talk to their pediatrician, but if they don't have a pediatrician, they can also contact the health department wellness line and find out how to be appropriately tested. Yep, great. Okay, so moving on, I didn't have anything listed from last time for old business. If anyone disagrees with me, please interrupt and chime in. No. Okay, so new business, I'm just kind of getting our updates from the community.
Before we go on to new business, there
go
is an
ahead.
item of old business.
Yeah,
Have you scheduled a time when you're going to talk to us about GLP-1 in agonist?
so we may have a different speaker in June that I'm just learning about now. If we do not, then I can speak in June, okay? Next month, I'll skip ahead to my county update. Next month, we are scheduled, and in case that falls through, maybe I'll get the GLP-1 talk together, just in case something falls through. But Samantha Cooper from the Delaware County Board of Health was planning to come to share kind of updates and what they're up to these days. I did take a look at the county website and their recent meeting minutes. They meet every other month, and I do have a plan to kind of review those so I can share information, but I thought I probably wouldn't share too much this month since Samantha's coming next month and will let us know what's going on. There is a lot on the website, once again, as I had mentioned last time, about closure of hospitals in Delaware County, not really in our area, but does influence the hospitals in our area, announcing closure, then reopening, and it's just kind of back and forth. Everything's still in the courts. Nothing has been resolved other than that the hospitals are open and seeing patients. And then there was, if you look at the Delaware County website, Board of Health website, there is a lot about the lead program on there. Seemed to be very proud of that. And there was also a kind of wellness, weight loss initiative that started in February, which looks like it's ongoing. But we'll have Samantha here next month, hopefully, to fill us in more. All right, so I kind of skipped ahead, but now I'll skip back. Jenny Lesage, our normal school liaison, is not present today. So we have someone in her place. I don't know if she has anything to share about the health of our students at this time or anything that would apply to the board. Thank you, Kate, for being here.
Thank you for having me. No, there is no updates at right now, but if you guys had any questions for the school, I can always bring them back to Jenny.
Are you guys still seeing flu in the school right now, or is that pretty much done?
Still some, but not as much.
One thing that I was wondering about actually earlier today, and I was thinking of communicating with nursing, we're talking about all this greater than 95% of the population we went immunized for measles, mumps, et cetera. I don't know what the percentages are in Radnor for our kindergartners or for our, fifth graders, et cetera. I imagine that data is probably somewhere. I could see if I can kind of tease it out, because I just would like to get a sense of, in our community, what percentages we have.
Percentages of kindergartners that are
Vaccinated,
vaccinated.
yeah.
I can get that.
I would imagine that's probably likely would be the lowest. You could look into previous years, but I would think that the kindergarten age would be the one that likely would have the lowest percentage as compared to, because it seems like it's more a trend in the community to not immunize. So.
And that's not required for a
Well, I mean,
school?
it is required by the state, but you can have a religious exemption, right?
Okay.
So I don't actually know what our percentage is.
So,
Sure.
yeah, so those data are reported generally in two ways. One is a prevalence data, which is usually estimated. What's the proportion of people that are vaccinated, and the other is what's the opt-out rate in a given closed population. And both of those would be helpful.
Mm-hmm.
Absolutely, I can look into that for you.
All right. Maggie, do you have anything to share with us from the Board of Commissioners?
No great public health-related issues. However, I have to put my Alex Yiannopoulos hat on and say, congratulations, you are the first female physician to be head of the board. I just echoes back.
As Alex likes to talk about that.
Yes.
So I'm
Yeah. No,
So right, you're taking it over.
Yeah, well, I don't know that I'm taking it over, but I did for that one. How about that? Otherwise, the only thing of any note is check the township website if you're interested in acquiring some bare root trees. Trees are good for public health. And there are several. There's a campaign going on through the Radnor Conservancy and one through the township, so through the Shade Tree Committee. So.
And I think it's the EAC lecture series. The next one is on the value of the canopy.
Yes, it is, and it's coming up soon. It's next Thursday, perhaps?
Maggie, do you have to qualify for these trees, or
You just have to ask for them. Yeah, I mean,
what kind of trees are they?
they're
depending on-
bare root native trees. It's a variety of trees.
like viburnum and
No, they're trees more than bush shrubs.
yeah,
I think of viburnum as a shrub.
it's a shrub. Yeah, but I
Yeah.
just think of it.
No,
as
these are
growing as-
trees. So they'll be local. I'm not sure exactly what kind. They do, some of them, that they will come and plant if it's along your street. Some of the programs plant, and some of them just you pick up the tree. I think the Conservancy, you just pick up the tree. And it's usually right here at the Township Building.
Oh, that's great.
Yeah.
Thank you.
So check out both those websites. They'll have more information on it.
Is the Conservancy, I don't know if you know this, Maggie, or not, are they also the ones who are involved with like the free mulch in the spring, sometimes?
That's the
neoparts?
Township.
That is the Township?
That's the Township.
Okay.
So our Public Works Department collects all the leaves in the fall, grinds them, mulches them, and then they sit over near Skonkalo in big long piles, and then they distribute it. I think it's more than like last fall's leaves. I think it might be the fall before's leaves that come out each year in various and sundry of our parks, which is free for Radnor Townships, not for your contractors, though, for your landscapers.
Excellent.
I think the Christmas trees go in there, too.
Before public participation, anybody have anything they wanted to add or bring up? Excellent. Okay, do we have any public participation this evening? I think our public present has participated already. So if no one else has anything else they would like to bring up, we can vote to adjourn. Next meeting will be April 21st, 2025, and hopefully Samantha Cooper from Delaware County Department of Health will still be able to attend.
Before we adjourn, I'd like to congratulate you for being first woman president and also for being the first president to get a meeting done before 6:15. 2 records in 1.
Excellent. Anyone move to adjourn?
Move to adjourn.
Second?
Second.
Second.